As a heart surgeon, I've been involved with evolution of heart surgery, heart treatment for over 40 years. In the last 10 to 15 years, I have seen amazing transformation in cardiac intervention, and some of them are nothing short of magic. And one of those procedures is a complex procedure called MitraClip. When we encounter a patient who's 80-year-old with multiple comorbid conditions, not really fit for an open heart surgery, we really didn't have an option just about 5 years ago. Today, our cardiologist repair the mitral valve with a device called MitraClip, with Eco-cardiologist guiding the whole procedure. Essentially, cardiologists are looking inside the patient's heart through the eyes of the eco-cardiologist. And what they perform is nothing short of magic. I'm amazed at the coordination between the cardiologist and the eco-cardiologist and the machine, how all this work together with the idea of giving minute details of the heart valve, which is constantly moving, because this patient is not even under sedation, and the patient's heart is working like a normal heart. And with all these limitations, the cardiologist and the team are able to do a phenomenal job so that in 24 hours, patient can walk out of the hospital. This is truly magical.